I get a ton of journals and I try to read them all, but I can't get to them. There's too many. There's just a flood, and I get emails and news every day. But certain articles will catch my attention. This one specifically, in the Journal of Family Practice. The question was, is the PSA test, the prostate-specific antigen test, supposed to be done or not? The United States Preventive Services Task Force, try to say that 10 times fast, USPSTF, they said we should stop doing so many prostate tests. And these two doctors are in a heated argument in this magazine about, well, you know, the USPSTF is absolutely right. And the other doctor said, that's crazy. And the reason for that is a PSA test will tell you if a patient is at risk for prostate cancer. It doesn't mean they have prostate cancer. It tells you if they're at risk. And the big question is, what does your doctor do about it? If a doctor sees an elevated PSA, it's above 4, and they recommend biopsy, that may be overzealous. They're doing too much too fast, and these guys argue about that. If a prostate-specific antigen is at 4 and it keeps getting higher and higher and higher and higher and higher, and you're doing something to treat infection and the causes of it, and it keeps getting higher, you probably want to consider biopsy. I'm talking about 3 months, 6 months, and seeing this progression. If you see that progression, that makes a lot of sense. If a doctor sees an elevated PSA and immediately goes to biopsy, there's risks associated with that biopsy that are serious risks. I don't necessarily agree with this, but there's some discussion about it may spread cancer that you already have. I think that's a low-level risk. The bigger one is you get infections, you get bleeding, you get all sorts of stuff. And for a PSA test that's elevated, you need to work with your doctor and say to him, hey, I'm watching my PSA closely. Would you be willing to watch with me if it continues to rise? During that time, you can do antibiotic therapy, antifungal therapy, any kind of natural therapies to improve your immune system. They all can make the prostate better. And that test needs to be done before the prostate examination, so that because the prostate exam can increase that level. So that blood needs to be drawn before the exam, and the blood test needs to be repeated so that we can make sure that that blood level of PSA is going up in a way that's scary, frankly. It goes up, 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 up real fast. It's called acceleration. So if those things are happening, your doctor needs to be on top of it. A PSA test is brilliant. It can help you really drive your sexual function, your longevity, all those things. It should be done. And your doctor should be in a relationship with you where you talk and you communicate and you can make sure that the tests that you're getting match your goals and that you don't go quickly to procedures that you don't absolutely need. Get with your doctor. We're better together.